Welcome to Mindfully Integrative Podcast with your host, Dr. Damaris G. Mindfully Integrative is a podcast discussing ways toward mindfully incorporating integrative health into our lives. This podcast will have informative resources, fun topics, interviews, and discussions relatable for today with a true mindful perspective in a mind-body, holistic life approach.
Hi, how are you? This is Damaris Maria Grossman, your integrative health nurse, and we're talking about pranayama techniques. Today's technique is use of incentive spirometer, but when you don't have one, how do you still work the internal inhalation of the lungs and trying to build up more strength so you can avoid atelectasis and build up strength. Now, I don't have an incentive spirometer with me, but when you're given one in the hospital for post-surgery, or if you've been sick for quite a while, it's a device that's held and it has a little tube and it attaches to your mouth. And when you inhale for a period of time, there's a little knob that you want to keep in a certain level so that it opens up and expands the lungs. It does this one usually post-surgery or post-anesthesia. Your body and your respiratory system has been depressed, and it is having a harder time expanding and having a harder time building up again that tidal volume. And what it does is this kind of brings it back again. And a prevention of atelectasis. And atelectasis is when one of the lungs collapses, so it's just the terminology for collapsed lung. And so what this is doing is it's exercising the internal organs and the internal muscles and the external intercostal muscles of the lungs. So it's really giving yourself a workout. It can be a little tiring, but worth it. So if you don't have an incentive spirometer with you, or you brought it home, or you still find yourself kind of long-winded or tired, and you need a little bit more strength, or you've just kind of come out of a cold, the flu, you've just been fatigued, this one I would recommend. So it's quite easy to do. You can be sitting down, laying down, wherever you are, and first kind of come into like a comfortable posture. I'm in a chair, so I'm gonna place my feet down into the floor. And this is an inhalation breath, not exhalation. So I'm elongating the inhale and not the exhale. What that means is I'm going to be like sucking in and imagining it as if I have a big shake, ice cream shake, or like milkshake, or something like thick, where it takes a lot of power to kind of get it all up. That's where the power and the prana in this technique comes in. And we're going to hold the inhalation longer than the exhalation. So the inhalation of this is going to be an inhale for 6 and an exhale for 3. So it'll be half the time. So I'm going to do a normal breath. Inhale through the nose. Exhale through the mouth. Inhale through the nose. Exhale through the mouth. Now I'm going to inhale through the mouth. I can even, if you feel comfortable, you can even imagine that you're like sipping into something like a big straw, and you're going to inhale for 6. Exhale through the nose. Inhale through the mouth. Exhale through the nose. Adding on to that, what I want you to do is you're going to inhale for 6. You're going to pause for 1 breath at the top, and then you're going to exhale through the nose. This is a little challenging, even for me. I'm just coming over some congestion, so I am noticing already that I'm a little tight. and I'm fatigued. So you will be tired from this. This is something to kind of build up your muscles and build up your body so that you become less tired. So initially you'll be tired, but then it will progress to getting easier. So we're going to try it one more time, holding at the top and then exhaling for 3 through the nose. So we're going to inhale for 6. And exhale for 3. Inhale through that straw. Exhale. To really get a deep, deep one, I want you to put your hands at your belly button, and I really want you to breathe in through that mouth, sucking in that straw really, really wide. Exhale. Great job. Roll those shoulders up, back, and down, and that is inhalation incentive spirometry without the use of an incentive spirometer. So if you didn't have it and you're trying to build and get yourself away from that cold, that's a way of building that inner breath. Inhalation a little bit longer. I hope you like that technique. Try it out sometime. And if you have any more questions, check out my website or YouTube channel. Text me or email me anytime. Have a wonderful day, or anytime it is for you. Namaste.
Thank you for listening to the Mindfully Integrative Show with Dr. Damaris Maria Grossman, family nurse practitioner. This podcast is for informational and educational purposes only and is not the substitute for professional medical advice, diagnose, or treat. Always consult your healthcare provider before making changes to your healthcare routine. Make sure to subscribe so you don't miss an episode. If you enjoyed our show, please support us by leaving a mindful review on Apple Podcasts or your favorite streaming platform. Interested in being a guest or more information? Email us at info@mindfullyintegrative.com. For resources mentioned in the show, visit our website at www.mindfullyintegrative.com. You can also connect mindfully with Dr. Damaris on her social media links found on the site. May your strength and peace guide you to find a mindful way every day. Namaste.